Welcome to Germany. Thank you for your speech. I would like to know, you mentioned, I think I read it, human rights or something in your report. So you are more focusing on a positive side of psychiatry that should be practiced with dignity. How much do you know about discussions, worldwide discussions about violence in psychiatry, and how much violence is acceptable in the field of psychiatry?
You mean, are you talking about what should be acceptable in terms of, can you explain that a little bit further?
Well, there are many bad discussions, negative discussions worldwide, also in Germany, that there's lots of violence going on in psychiatries, and which is not talked about. The people do not talk about, they deny it, or they lie it's not happening, but there are many, many people, many victims who talk about it. So what is acceptable, what do you know about it, and what is your idea about it?
Well, I mean, psychiatry has a murderous past. Was one of your, I mean, this is our history, and we suffer from that, and psychiatry is changing all the time, and we are, of course, our practice and our aim is humane care, and practicing in a way that upholds human rights rather than abuses them. The area that, for instance, with the UN Convention on the Rights of People with Disabilities, CRPD, people focus on the use of coercive care, and that's one important area. It's also equally important that people are not abused by being excluded from communities and opportunities. And a lot of the convention that it refers, as you may well know, to providing the opportunities in communities for people living with mental ill health. And I think that the short answer is that violence is not acceptable. In the past, there's been the terrible examples that are on exhibition here, on the T4 extermination and the killing of people, in fact, with disabilities. Many other places, there's been the practice of eugenics in one way or another, in the United States in the 1930s as well as in this country. We had a session yesterday afternoon about whether psychiatrists should apologise to Indigenous populations for the way psychiatry has been used. In a number of the post-Soviet countries, the debates continue about the political abuse of psychiatry. Of course, none of this is acceptable. We have codes of ethics in our association that prohibit this from any group belonging to the World Psychiatric Association. Where it becomes, the discussions need to be much better informed than they are now about how to deal with the need for understanding people's wills and preferences when they're not in a position to express them. And we've worked in psychiatry in the principle of best interests, which we're trying to change into understanding wills and preferences. So we need to understand the human rights dialogue rather than getting upset and saying we can't practice psychiatry without coercion. We need to say, just as the rest of healthcare needs to say, if someone is delirious, do we let them jump off the balcony? Or do we treat their urinary tract infection even though they're not in a position to give permission for that? So we need to join forces with the rest of healthcare and debate the question of how to achieve the appropriate balance in protecting our community and our patients, and to make sure that the initiatives like the WHO's quality rights initiatives are understood and expanded where needed. And that's an answer I hope I'll be able to give you in a more full manner in 3 years' time, because we're establishing a task force on creating a conversation between human rights and psychiatrists, experts, to consider just this point about how we implement the CRPD, how we participate in implementing the CRPD, in what ways. But it's never acceptable to abuse patients. It's never acceptable to use coercion unless it's very carefully understood, the basis for that. It's my view.
Thank you very much. I think these are, I'm happy that we've heard these words as well to set also a little bit of our moral and professional compass here. And so I'm